Good afternoon, everyone. Thank you so much for joining us in breakout session number 5. We're going to be talking today about how housing is community and how we can help different community members have access to housing with strong support services. So I'm going to start just for a quick moment and tell you about a friend of mine whose name was Josh. I got to know Josh when he was 23 years old, and it was because I was working at a company and he became an employee. And he was part of a job training program for a nonprofit that helped people with disabilities. And so Josh came into our firm. We were affordable housing developer, and it took him a very short period of time to realize what we actually did at our firm. And quickly, he started telling me the things that he wanted in his life. Number one, he was sick and tired of living in his parents' basement, and he wanted his own apartment. He loved having a part-time job with us, and he wanted a girlfriend. And the more I've been in the supportive housing community and worked with people that was either in transitional or permanent supportive housing, and frankly, all of us as humans living on the earth, I think we all really kind of want those same things. We want independence, we want meaningful work, and we want love in our lives. And all that is really possible through supportive housing. And today we are going to be thinking about what supportive housing looks like, what types of services come along with it, how long do people get to remain in supportive housing, all those type of questions, lots and lots of examples, and we're going to end up thinking through what can we do in Nevada. So I'm going to introduce myself just really quick. I'm Audra Hamernik. I am the president and CEO of Nevada Hand. We are an affordable housing developer in Southern Nevada. We help around 7,600 individuals with affordable housing. We have around 35 apartment communities, and I'm very, very happy to be moderating the panel. But we're going to hop right into this because we have 4 terrific panelists, and I don't want to waste one more minute until you get to hear from them. We are going to start with them each introducing themselves and telling us a little bit about the different types of models that their agency uses in solving housing for community. And all of these panelists have some sort of project that are connected to supportive housing. So let's go ahead and start with Dorinda. Hi there. Can you introduce yourselves and tell me a little bit about your project?
Thank you, Audra, and thank you everybody for being here today. It's an honor to be alongside all of you. So I'm Dorinda Schubert, and I am the executive director of Bridge Meadows here in Oregon. And Bridge Meadows creates purposeful communities where kids and families and elders thrive and flourish. And we have a very special purpose, and our purpose is to help children who've experienced foster care have forever families and housing stability and the love of elders who serve as mentors and surrogate grandparents to kids. So all 3 generations come together and they live in this very beautiful community that you're seeing on the screen there. That is our North Portland community. At this point, we have 2 communities in Oregon, and our 3rd one is under construction right now in Central Oregon. Our dream is to be everywhere. And I've had the privilege of talking with some folks in Reno, Nevada, about dreaming about Bridge Meadows coming your way. So my family, who lives in Reno, would be very happy about that. But let's talk a little bit more about Bridge Meadows. I should also tell you that I am a clinical child psychologist, and I came to this company as a board member. And what it meant so much to me was I was watching children and families in mental health, very high quality mental health services as the chief operating officer of a really large mental health agency. The kids and families were getting high quality care, and then they'd leave. And then I'd worry about them and what would happen. And the hardest part was watching children who left with their caseworker and a little duffel bag in hand. And I often wondered, what's going to happen to you? Where are you going to be? You are going to end up in a system that won't be good for you. And worse, we're going to miss out on all the gifts and talents you have to share with the world. So I was introduced to this model of bringing 3 generations together to solve some big issues, and became a board member right away. And a year later became the executive director 13 years ago. So I had to learn a lot about real estate development I have a little junior after my name when it comes to that. But here's what we do at Bridge Meadows. We create this beautiful housing with great intention. It has we'll talk about this later, but there's lots of intention about how we keep everybody safe, how we build connection on purpose and accidentally, so that we build those connections, because we believe through those connections, relationships are built, and then well-being happens, and then people flourish. That's our theory of change. And we have a therapist on every campus who provides knitting the community together, because you can't just expect 3 generations to come together. Some part of that population has experienced trauma. It's not going to go easily. So the therapist educates our elders about what it means to be a child who's experienced foster care. Also, a variety of other topics: depression, attention deficit, hyperactivity disorder, beta alcohol syndrome, you name it, the education is happening. The therapist also helps mediate and facilitate relationships coming together, knowing that Johnny over here needs help with math, and our elder Linda is a really great math teacher, retired. Let's bring those folks together. It does happen organically, but we do something like, we call it bridgemeadowsmatch.com. We help people come together. What also happens is our therapists connect to the greater community and bring in services. The voice of the people who live at Bridge Meadows helps design what happens at Bridge Meadows and what the services are. So we partner with, for example, the Oregon Health Sciences University with their nursing students who come and do foot care and diabetic education for our living with diabetes education. Those are some examples. And probably one of the most important features that our therapist does is conflict resolution. In our communities, you may be arguing with your neighbor, and you are also invited to the birthday party later on in the day. And you got to show up all like supportive and kind and caring. You cannot show up with a grudge. And so our therapists really help with all that conflict resolution. The families come to us through the child welfare system. They're referred to us. The elders come to us from all over the country. We have been blessed with a lot of national media coverage, and then that brings people our way. We ask that the elders contribute 100 hours a quarter of their gifts and talents so that they are living with meaning and purpose. Long ago, we were able to attach that to the lease as an addendum, which I know is making all of you go, what? Yeah, that lasted a little while. And then some folks at the state said, yeah, you guys can't do that. And so now it's more of a peer pressure type of thing. But truly, when you are reading to kids, taking your neighbor to the doctors, participating in community events, your life is enriched. And so there's benefit. And we all know, all of us did not need a global pandemic to tell us how bad social isolation is for people's well-being. We are, I jokingly say, the anti-social isolation communities, because you really are wanting to come together. We build some of our buildings so that you can see if the lights are on, and if people are in that setting, so that if you're feeling lonely, you might want to go work on the puzzle or play a dice game. So there's just a lot of therapeutic intention there. Everybody pays rent, and there are no limits on how long people stay. We've been sort of challenged about that, but we cannot decide how long it takes a child to even out from trauma. The trauma will always be a part of that child's life, but managing it throughout time takes time. And there could be times of quiet and settle down. And then there are times where perhaps it's an event like going to prom and your birth mom can't be there, and you may have a spike. And so what's lovely is that we haven't done that, but people move, all the reasons you and I would move, to buy a house, to be with other relatives nearby, or for a job. So we haven't, we're okay with the fact that we don't have an end date. Now families will move once all the children launch, and because then we want to make it so that there's opportunity for others. So the other last thing I want to share with all of you is that adjacent to Bridge Meadows, we created a program for youth who've aged out of foster care. And those youth are 18 to 24 years old. They live nearby, and we did a joint venture with another nonprofit organization. And in that and they bring the services, and I say we bring the grandma love. So right now, in the middle of a pandemic, we are having a food bank deliver food on a weekly basis to Bridge Meadows, and the youth are able to come and participate in that piece of it. Sadly, they can't participate in everything that we have going on. Well, actually, we don't have a lot going on right now, right? You can't bring people together. But some of those bonds are remaining as those youth launch. Some of them are maintaining those long relationships with the elders in our community. So I think I'm going to pause there, Audra, and to hand it back to you.
Great, thank you so much. So next we have Josh Mcmullen. Josh is the Housing Director with Northern Nevada Hopes, and we're excited to hear about your supportive housing.
Thanks, Audra. I'm so excited to be here. Great panel, great discussion. So let's jump into it. So at Northern Nevada Hopes, we began in '97 as a primary care, as a care center for people that had HIV and AIDS. And from that, we've then moved into become an FQHC, which is a federally qualified health center. And we now serve 12,000 individuals. We served 12,000 individuals last year. And housing is really one of those pieces that our company looks at as being just as important to health as going to the doctor or getting your medications or, making sure you see your psychiatrist, which you can do all that here at Hopes. We've really created a system where we're wrapping around services so that we're helping the individual with whatever needs that they have as much as possible. So in terms of housing, we run 4 different programs right now. One of those is for our HIV and AIDS clients. It's the largest that we have. And it's really, there's a few different parts of it. There's one that's rental assistance short-term for like emergencies. There's one that's rental assistance long-term for people that are trying to transition into low-income housing or just housing that's more affordable to them. Our ultimate goal with that is to get people into a place where they can pay 30% of their income, and then we can step out and just provide support, not monetarily, but we can provide support in terms of case management, doctors, pharmacy, all that stuff. So that's one. We have PC housing, which is for our primary care housing. And that's for anybody that has rental issues, mortgage issues, you need help finding a place. That would be the place to turn to if you are just a primary care patient. And so in most cases, what we do with that one is we are really helping people pay their rent so that they don't become homeless. And then we start, a really bad cycle within that. So we have that. Then we have a program that we work with the county. We're on a county grant, and we're trying to get people back into housing through motels. And so we'll meet with them. Typically, we would do outreach. We've stopped doing that because of COVID, but we still have people that are coming in that are seeing providers or just know about us from the community, and they will come in and talk to our case manager that does that. And then the last program that we have is called Recuperative Care, and that is a program where we have people coming in that are experiencing some sort of really bad illness, injury, burn. We've had people that have had burns that are trying to recover from that, and they're homeless. And so we set them up into a motel, and then they will have a case manager come and talk to them 2 times a day. And then they will also be coming back to the clinic for different things. So if they have wound care, they'll be coming here every day to get wound care from one of the nurses. If they are, if it's something else that they need to see a provider regularly for, they would come in and see our medical providers for that. And then we try and transition them back into housing, whether that's temporary housing in a motel or more permanent housing, which is a little bit few and far between right now in Reno. So Those are the 4 that we have going right now. We also have a 5th program, and this kind of gets into, you know, what we're really talking about today. Our 5th program is called Hope Springs. It is a 30-unit tiny home project that we have a community center based in that area, and it sits on a little over an acre worth of land. So it's pretty tight, but within that, we're going to be welcoming in residents in January, and the residents will come in from being homeless. These are all people that are chronically homeless, and they will they will get a tiny home for themselves, and then they will start working through their program. And what that entails for us is we're going to be building a community as we go along. So we're going to be teaching some things, right? We're going to be teaching a person, how do you handle all your, you know, landlord issues that you might have? How do you deal with a neighbor that is, you know, not so nice to you? How do you go about putting together a resume to get a job again? You know, I have to think about these things for a person that has been completely out of that realm to come back into something and try and work within, you know, normal daily living that we all typically experience is totally different. They are really concerned with 3 things. People that are homeless are typically concerned with 3 things while they're out there, and this kind of goes in a circle. One is, how do I protect myself? 2, how do I protect my stuff? And where am I going to get food from? And those 3 things really kind of go round and around. And so what we're going to do is we're going to kind of look at a sort of a recovery model based off of that. And it's not, you know, it's not for people specifically that have drug or alcohol issues. It's for people that are homeless, but we still look at that as being like a way that you can recover from that so that, you know, you can be whole again. You can get back out and you can live your life in the community and be independent. And really that's really the point. After a person graduates and they move into the community, we really want them to come back in and be mentors and be connected to the community that we've created at Hope Springs, so that then it just gets bigger and bigger. And, you know, there's a lot of people out there that you can go to and ask for help when you graduate. That's really our ultimate goal. So our hope is that we will, you know, take this 30-unit place and we will be putting a dent in the large homeless population that we have. Even though it's only 30, this is where we start, and we'll see where we go. So thank you.
Great, thank you, Josh. So next I have Carol Simler. She has recently, very recently retired from DuPage PADS. And Carol, tell us about PADS and some of the work that you were doing in supportive housing.
Sure. Thanks, Audra. DuPage PADS, we're committed to end homelessness here in our county. And we believe that we've got the solution. The solution is housing, coupled with support services and employment. And right from the get-go, I'm going to say homelessness is morally wrong. And so that's a pretty strong statement. But I realize that it's a complicated problem. But one thing that ends it is housing. And I believe so strongly in that. I'm recently retired, but I haven't lost my passion in terms of ending homelessness and people's dignity and respect. And while we provide interim housing, that changed with COVID. Now we're a hotel model and rapidly rehousing people. We have respite care, we have support services, we have employment services. But the one thing that I'm so excited about is permanent supportive housing, because permanent supportive housing for us as individuals, families, and veterans, it restores a person's or family's dignity and give them the respect that all of us deserve. So our goal in supportive housing is affordable housing and support with wraparound services. We know from our research, from our studies, that it improves health and behavioral outcomes. We see community integration for our residents. and people are staying housed. And that's the beauty of this. As I love our tagline at DuPage PADS, when someone believes in you, everything can change. And that's what we saw. Finally, someone believed in that person or that family to have a better life. So supportive housing, we've got 145 scattered sites. We have our own apartment building. That's how I met Audra years ago. And we believe in that housing first model, people first. So I'll pass the baton on and I'll come back to you.
Okay, great. Thank you so much. And next we have Carolyn Parawi. She is from Thresholds. Thresholds is this great organization who does a lot in Northern Illinois, both affordable housing, but also behavioral health care. So Carolyn, I'm anxious to hear what you have to say.
Thanks, Audra, and hello, everybody. I apologize. I do have a little bit of a cold, so if anybody has trouble understanding anything I say, feel free to hit me up in the chat box and I'll try to clarify. But as Audra said, I work at Thresholds, which is a nonprofit in Chicago and in the surrounding areas that provides mental health services and housing, primarily to adults living with serious mental illness, many of whom have experienced chronic homelessness and also struggle with addiction. Thresholds is Chicago's biggest supportive housing provider. Right now we have about 1,000 housing units and 80 residential locations in the area. At Thresholds, we really believe in housing as harm reduction and as a basic human right. As Carol said, you know, housing it provides people with a lot of dignity. And then within the context of the housing first model, we believe that the stability provided by permanent supportive housing in conjunction with robust supportive services, individuals can reclaim a positive sense of self and discover like their own potential. At Thresholds, we aim to take a really integrated approach to improving mental health, substance use, and overall health in helping our clients stay successfully housed. To achieve this, we provide community-based services, often mostly by case managers, trained clinicians, nurses, and employment specialists, and substance use counselors to help support our clients' recovery. We also aim to be really comprehensive in the service delivery that we provide. We also certainly partner with a lot of other resources in our community. I'm really excited to be here today because in my previous job at Thresholds, I did quite a bit of kind of the front end interviewing of individuals that were identified to come into our housing, people that had experienced chronic homelessness and a lot of instability and like lack of available resources throughout their lives. And I really love to be able to ask people like, what is it that you would want to do with your life if you were to get housed? And people would say to me all the time, you know, it is never something that I felt like I could actually think about without having somewhere to like lay my head down at night and have some predictability to my life. And just to like see the light go on in people's eyes and think about the things that they could achieve with housing, like getting a job, going back to school, or even something as simple as like learning how to cook and just having their own space to read a book and watch movies. It was so inspiring. You know, we always think about at Thresholds like Maslow's hierarchy of needs and how, you know, food, shelter are so important to people being able to move forward in their lives. So I'm really excited to be here, and that's just kind of a brief introduction to me and what we do at Thresholds.
So I think it's really interesting that we've heard about several different types of models for supportive housing. And I don't think there is one right answer to permanent housing because there's lots of variety of needs for the individuals and the families, but there's also a variety of needs in every community. And over the years, I think I've been convinced differently on supportive housing and permanent supportive housing and transitional housing, right? I think the more I've learned, the more I see the need for each one of those types of pieces in this puzzle. So I want to bring one other thing that I think is interesting with the different projects that we're looking at. And one thing that's similar, they're all offering support services along with the housing. And the types of people that are residents in these affordable housing communities are very different, right? Sometimes they're homeless folks. That's the target. Sometimes they're just behavioral health. Sometimes we've heard HVAC aides. We have this really interesting combination of children in foster care and seniors. I mean, I just think that's the coolest thing, Dorinda. I've never heard of this model before. So there's all these just neat web of people that come together with the common need of support services to remain housed. So I want to talk to Carolyn a little bit about what does that mean? You hear people talk a lot about wraparound services or strong support services, but what does that mean to Thresholds, and what types of services do you provide to your residents?
Sure. So at Thresholds, we really kind of define wraparound services as strengths-based and a needs-based approach to create independence and stability. What we traditionally do when we have somebody move into our housing, or we're preparing someone to move into our housing, we will do a comprehensive assessment with that individual to really learn about their goals, and we'll also try to learn about what kinds of strengths they possess. Just some examples of some things that we really try to highlight at Thresholds are like people's cultural identity, their connection to spirituality, talents, interests, family, optimism, resiliency. So many of the people that we encounter have experienced so much, and the level of resiliency is astounding. Their interpersonal connections and things like that. So we really try to use what they and we assess to be their strengths to help them identify some meaningful goals that will help them again move forward and kind of reach their own potential, and things that'll help them remain housed. So we can create goals that will help them to manage their depression, or maybe help them be a better neighbor, work on their activities of daily living. Like a lot of people that we encounter don't know how to cook, or they haven't, they need a little bit of help learning how to like housekeep and things like that. So we'll kind of help them identify goals, and then we'll put in place the proper people at our agency that can help them move forward with those goals through like our integrated healthcare clinics, our clinical case managers, and things like that.
Okay, that's great. That's great. And Josh, I think it's really interesting too that you have a major healthcare component. In my experience in permanent supportive housing, oftentimes we were seeing an individual that maybe on one hand was being held by a behavioral health care specialist, and on the other hand, somebody that was just primary health care, right? Someone that could really help them through, especially folks that have left street homelessness, that just had not had the ability to take care of themselves very well.
Yeah, correct. I think something that Dorinda said earlier about, she would help people, and then she would watch, the kids walk away with the worker with a bag, and then you don't know what's going to happen. Before this, I worked with people that had severe mental illness, and it was great because we had everything for mental illness in one spot, but that medical piece was elusive, and we never knew who they were going to. Typically, we wouldn't know where they were going, if they were getting really good care. Those types of things were always a wonder or a worry. And here at Hopes, to be able to wrap those services around somebody and have the housing case manager actually follow up with the provider in real time to find out what's going on, and if they need a certain medication, and that medication might need to be done now, or whatever the case may be, I think is really important. One of the things that we're going to try and do with the new project of Hope Springs is we will have, when somebody comes in, the day that they come in, we'll have them go ahead and do a primary care visit on that day. We'll get all their vitals. We'll probably wind up doing some lab work, and then we're going to follow that. And we're going to see what the health outcomes of them being in housing and in support housing will look like as they move through it and as they transition out as well. I have a feeling that we're going to see some really good results, but we're going to know when we get there. Just my thought. I think we're going to be seeing some really good results for that medical stuff. And then that just kind of solidifies how much housing plays a role in health as well.
That's great. That's great. I think it's interesting that lots of times when I would be touring maybe an elected official of a permanent supportive housing building, at the end of it, they'd say, oh, so it's just an apartment? And we'd be like, yeah, it's just an apartment. And they have a 12-month lease, just like everybody else kind of does. And they have keys, and they, the difference is if they have support services that come along with that. So I love looking at your models because it's that, but it's in different settings, right? So we've heard about scattered site, which means it could be, for example, it could be a couple units in a Nevada hand building, not the entire building. We've heard individual apartment buildings that it is the entire building that is permanent supportive housing. Josh, you're doing a tiny home community, which is cool. Dorinda, you've built a community of different types of housing styles for different types of tenant. I mean, it's not one size fits everything. So Carol, I'm going to come to you and ask, so what does permanent supportive housing look like to you? And what types of stays do people have? Like, is there a time limit? Can people stay forever? What does that time look like for you?
Sure. We have both. We have scattered sites and we own a building. And, it's funny when you mentioned about legislators, I just go around with a 4-foot key and kind of looks like this. And I tell people, housing, that's what all of us want. We want our place to call home. And then I talk about the keys and how important that is. I get upset when my garage door opener isn't working, much less I don't have a key for my front door. And so for me, what does it look like? It looks like an apartment. It's what it looks like that people can afford. For us, people pay 30% of their income. And also, for us, we walk alongside with the folks that are our residents. And Caroline talked about that. About the wraparound services that are needed. But it's also a way to engage the community and understand. We live in a pretty wealthy county here in Illinois, and people think homelessness shouldn't exist, or it doesn't exist, either way. But when you get to know a person's name, everything makes a difference. And so I believe that everybody should have a place to call home. I don't care what size it is. So I've seen a number of different models. For us in our county, it's 1-bedroom apartments or 2-bedroom apartments. We don't have housing here that could just be small enough to have a bed and a small kitchen. And so for us, it's apartments. And for us, we engage the community in getting those apartments ready as well. And so the other is, this is their home. And people will say, and I too, Audra, what you had said, there's different models, transitional housing, permanent supportive housing, all that. And they're all needed for different populations. That different people need different things. But for us, permanent supportive housing, this is their home. And there is no time limit on it. I've seen people move onto their own place in the community that they've been able to do. and that's fine. But these people that we're working with, people who are homeless, have left a pretty traumatic past. And we all know they bring that trauma with them. And so for us, it's to, as Caroline had said, what are those supportive services? What is the need? Looking at their strengths. And for maybe this is the first time anybody really looked at their strengths. So I also, what I'm, and I can talk about impact and I can talk about all that, but you know what the blessing it is? Family reunification. Because those folks coming in have lost their support system for the most part. And so we've become that support system. But I've seen time and time again where families are reunited again. And that's a beautiful thing to witness. So does that answer your question?
Yes, ma'am. Thank you. Permanent supportive housing means permanent.
Correct.
Okay, now,
Bottom line.
okay, Dorinda and Josh, I'm really interested in this for both of you because since you both built actual communities, and I'm an urban planner, a recovering urban planner, you had to make some really intentional choices, right? Like you had to with the site design, with designing the apartments. I'll tell you one fast story. Years ago, I was asked to help with a HUD grant application for Catholic Charities in Chicago, where it was for grand families, so grandparents or great-grandparents raising children. And at the time, I had a 3-year-old. And we thought we were so clever. We're coming up with all this really neat stuff in the apartments, and the levered handles to get in and out. You could use that for someone who was elderly, and you could also use that for if you had a stroller in your hand and blah blah blah. So fast forward a couple weeks after we submitted our grant application, and I'm in my in-laws condo, and we can't find my 3-year-old. He was in the hallway because the levered handle. And the first thing I thought was, oh no, we just put that in that application. Those kids, it wasn't that great of an idea. So you have to have those moments of intentionality where you're thinking, this was a great design element. And have you learned any throughout this that you're like, didn't work so great? Because I liked your example about seeing the lights on.
Oh, yeah. So, well, first we start with universal design and age-friendly design principles because, as you know, if you're in a stroller or a wheelchair, that is what you want to have happen for everyone. So so some of the things that have happened well, first of all, we design it so that everybody's got the backyard, and they are, you can be a parent washing dishes and see the kids out in the backyard. Our houses have 3 and 4 bedrooms because the average size of a sibling group in foster care is 3 kids. So we wanted so can everyone hear our dear friend who has not put themselves on mute?
Here, you want a Coke?
Like the person named Dee Dee, if you could mute, I'm so sorry to call you out, but I can see your name. If you could mute, thank you.
Oh, thank you, Dee Dee. Just a moment of levity in the middle of our presentation. That's all. Okay, so anyway, we created our houses for the families are 3 and 4 bedrooms because the size of the sibling groups, because kids get separated in foster care, and that's terrible. And we too, Audra, have mostly grandmas at Bridge Meadows communities because grandma is the person getting tapped on the shoulder to scoop up all the grandbabies when they get put in foster care. It could be aunties and uncles, but it's a relative. And so some of the things that we've done are, of course, the elevator for the elders, and the kids don't have access to a fob, but they get the fob because the kids, the elders have their, as they call it, the big house, the big building, and then there's some scattered elder apartments around. And the fob, kids get a hold of that, and then the elevator becomes a big joyful moment. So I think that's probably been one of the funniest parts. Or the kids are running around like it's the Indianapolis 500 in there. But some of the blessings have been that courtyard and that backyard. That's where a lot of magic happens. And also we have a big, beautiful community room that has hosted happiness hour every Wednesday afternoon before COVID. Everybody comes together and has a meal to build those connections. And funerals have happened in there,
Mm.
and adoption ceremonies. The judge comes from the courthouse. So I think that it was lovely that our architect, I think, has the heart of a therapist. Because when I first met him, I said, "Don't draw. I need to tell you what we need and what we want and who's going to live here." And he took those words and he made our communities in such a way that when you interview an elder or a kid or a parent, one of the top 3 things they'll say to you is, "I feel safe,"
Mm.
and then I feel worthy.
That's great. That's great. What about you, Josh? I'm really curious about your tiny home community. And do the tiny homes have their own bathroom, showers? Do they go to community space? Like, how does the communal versus private space work?
Right. So for us, we have showers and bathrooms in the community space. So nobody has it in their homes. It was cost prohibitive and also prohibitive on the land that we developed. We were granted the land by Reno, and there's a lot of utilities underneath the land. And so if we need to, we can go ahead and pick the tiny homes up and move those so that they can still access the utilities. So that all kind of played a role in that. But we also kind of feel like that we don't want people to just be hanging out in their tiny homes. We want to be out in the community and experiencing each other and all the things that we have. So a few of the things that we have that's kind of unique to us, and what we've noticed is that, there's a good amount of people that are homeless that have animals, and primarily dogs. And so that really limits where they can go. I was working trying to get people back into housing. There were only certain motels that would actually take somebody with a dog. And typically, if it was a small dog, that was okay. If it was a large dog, it was totally a no. So we have in ours, it's very dog friendly. Open. We actually have kennels on site that will be really close to the tiny homes, and the kennels will be air conditioned and heated. There'll be water that goes directly to the kennels themselves. We'll actually have a dog park as well. So the expectation is that when somebody has something else that they have to do, if they have to attend a class, group, whatever it is, they can put the dogs into the kennel and start to train them on what that's like for them. When they're in their tiny home, then it's okay for the dog to be in the tiny home with them as well. So that's one of the things that we've kind of done that's a little bit different. I think also, making it a space that people want to be outside is really important as well. So when we did that, we thought, okay, what would keep people outside more? We made an open concept inside the community room. And in that open concept, there's 2 bays of double doors that face south, which is primarily where all the homes are. And there's also roll-up garage doors that have, they're see-through as well. I'm not sure if that's glass or plastic, whatever it is. And so on, really nice days, which we get quite often here in Reno, we can roll all that up, roll the 2 doors up, and then open the other doors, and we have kind of an inside-outside space. Then outside of that, we have a barbecue pit and also a fire pit for people to kind of hang out and collect, and kind of catch up with each other. So there's that. We also have a large garden. We're going to have trees, things like that. So again, we really tried to incorporate where somebody wanted to be, and then also what we could teach out of that as well, because everything is purposeful, as much as we can be, in the way that we designed it. And so having an outside space where people can collectively talk, that really played into our favor. We designed this thing before COVID happened, but to have it now is like, man, that was genius. Before we looked at it like, this is going to be a great place for people to sit and congregate and talk. Now it's like we'll probably be hosting some groups outside and things like that so that we can keep distanced. So a lot of that went into it, and that was not me. That was the facilities director that really had a hand in that. And also, Dorinda's talked about with the architect as well. I think our architect, hit it really spot on. You look at the renderings that he had years before we really started breaking ground on this and what it looks like now, and we are really close, which is kind of a rarity. So I think it's everybody just coming together and making that whole for the people that are going to be utilizing this.
I agree, Josh. Having the garden and benches strategically placed around the community has been such a blessing during COVID. And we've been able to still conduct services 6 feet apart and just find ways for people to connect.
Cool. So we've had some questions about, so this sounds great, guys. How do you pay for it? So let's start with, we're talking about 3 different budgets here. The first is a development budget on how you build this stuff, right? And that's a completely different session. The second is once you've built it and you have annual operating expenses, how do you pay for that? And I can tell you that it needs to be rental income. All of these projects are self-sufficient, and they should be, or we'd never get lenders to participate. So that's number 2, and that's also another session. So we're going to focus on the third type of budget here, and that's really how do you all pay for your support services? There's a lot of talk going on right now in Nevada about a new tenancy services bucket coming to us under Medicaid. So that's going to be new for us. The rules aren't out quite yet, so we're all excited to see that. But can you talk a little bit about, Caroline, all of you, how you pay for your services, and let's just start with that. Do you want to start, Caroline?
Sure. So at Thresholds, we get a lot of our funding from housing, or for housing through HUD, and through like the Chicago Housing Authority, or the Department of Mental Health provides us with a lot of grants. And then our biggest revenue stream outside of those things is through Medicaid billing, which we do kind of more on the mental health side of what we're doing. Audra mentioned rules. There are a lot of them. They have a kind of a guide book, I guess, of the kinds of services that we are authorized to provide. Like I mentioned, case management, the clinical services, employment services, and then there's all sorts of parameters that we need to follow within those. And then our staff provide, they have a kind of a daily quota of notes that they have to do to just summarize, I guess, the medical necessity for why we're performing a service with an individual. And then we talk about what interventions we provided, as well as the outcome and the next steps. And so that's probably our biggest revenue driver at Thresholds.
Yeah. So I just want to mention that at Thresholds, you're a behavioral health agency, right? So they have a long history of providing behavioral health care that fits beautifully into this Medicaid model. And that's not always the case, right? So in some cases, like Carol, at DuPage PADS, you didn't have behavioral health folks on staff, but you certainly referred to those people, or it could even been the county health department that you were referring clients to get those services. So since you didn't have that component, how are you paying for your support services?
Sure. HUD funded.
Continuum of care?
Pardon me?
Was it continuum of care money?
Through our continuum of care, it's HUD money. And through that, we get the rent assistance and also a case manager with that. Now we have an activities director as well. And we also provide healthcare through agency services and the DuPage County Housing Authority for our building. We have that project base there.
Great.
And then also through our donors as well.
So just out of your 4 panelists, are all of you a part of a continuum of care in your communities?
Yes.
You're not? You are? Josh?
Yes.
We are, but we're not necessarily like, they can't refer somebody directly to us for automatic entry. That
Right.
makes sense.
Yeah. So it's going through their system of referrals, but you participate in the continuum of care?
Yeah, we actually participate in the Reno or Washoe County Continuum of Care, and then also the rural Continuum of Care, which is all the other counties with the exception of Clark and Washoe.
Okay, great. And then Josh, how are you paying for your support services for your tenants?
So we have a few different ways to do that. With the Washoe County grant, that will cover a lot of the costs for our primary case manager. We also we have a person that does just grants for our company, and she is really good at being able to find things, locally, nationally, wherever it is, she'll find it. And so we'll have a peer support specialist on site. For those of you that don't know, a peer support specialist is typically somebody that is now certified to work with the population that they kind of came out of. So for the person that we have, he's homeless and he also had addiction issues. And so he will come in and he will really connect with the people that are on site. So because of that grant, we're getting that paid for as well. We'll also have a lot of donations. Now that we're almost through our capital campaign to build it, then we'll start concentrating on operations. And then we're hopeful too that the new Medicaid rules will help us with our funding through housing as well. Then there's a possibility of us doing some other psychosocial rehabilitation, basic skills training, that sort of thing to get reimbursed by Medicaid as well. So we'll see. I think there's a lot of opportunity for us still. We haven't really tapped into, but I'm really not worried about it. I think once we get going, then the money will be there for it.
Great. And what about you, Dorinda?
We have a small grant with the Department of Human Services for child welfare. We have tried to get one with the elder services, but not lucky there yet. But that took 8 years to come by because we don't fall into anybody's buckets, or you can look at it as we fall into lots of buckets. And so, the housing folks sort of look at us like, what are you doing? And then the child welfare people are like, this is so awesome. Yes. And then, so anyway, it took some creative leadership, new leadership, and a leader who was just sold on the model to say, we're going to find the money for you. And then Portland, the city of Portland has a children's levy, and for the first time ever, we're getting some money from there. But mostly before that, it's all been philanthropy, foundations, events, and individuals donating to us.
Okay, I just want to make this quick statement, and then we've got 2 quick polls that we're going to be doing. But one of the things that I think is really interesting about permanent supportive housing and is thinking about how, if we keep people in a housing system with these support services largely occurring at their home or nearby, right? We're keeping them out of other systems. Hopefully we're keeping them out of the healthcare. We're keeping them out of the emergency room. Perhaps we're keeping them out of the correction system. All these different kind of connections that frankly are really expensive, that we could, that just having a person in an apartment who's got some rental assistance and that's helping, we talk about 30% of their income. Sometimes they really don't have a lot of income, right? Sometimes it's SSDI and they're making $700 a month, and that's not going to get you a lot of an apartment and food and everything else you need, right? So what if we give folks rental assistance and then these strong support services, you can see how that package kind of, and you can put math to that, right? You could easily put math to, this is about what all these things cost. And when you add all that up for an individual over a year versus one emergency room stay, or, two visits to the sheriff's department because of odd behavior, not particularly bad behavior, right? Like it's sometimes those things happen. So I love permanent supportive housing in a big picture community sense because it keeps them where they should be housed, and not necessarily spending all this other dollars on all these other systems that really aren't necessary if they had the support services that they need. And I always like to think about it as it is services that they need, not more and not less. It's somewhere in that sweet spot designed for that particular household. So we had some good comments on the side about Title 19 Medicaid. There's also some state grants in Nevada for Healthy Nevada. So those are some nice additional comments. And then we have a polling question for you. And we'd like to see what you think in 1 or 2 words, what you think the challenges for doing this in Nevada would be. So Gwen, can you do your magic and have this thing pop up here? Oh, so this is, oh, sorry guys. I was supposed to have you start with this one. Shame on me. I was so excited to jump into supportive housing. Start with this one so we know. Okay, what's your professional sector? If you do this one quickly first. Ah, okay.
Right, just take your phone and aim it at the QR code. Slido will come up. We'll give it a few more minutes. 8 people have done so. Thank you. See you polling. After this one, there's one more. And at the end of the program, there's 2 more polling questions if you like to take those polls too. Okay, 22 people have polled, and one more moment. Doing a 10-second countdown. 5, 4, 3, 2, 1. Thank you so much. It looks like the professional sector is a housing developer, the majority. Thank you so much for this information. We really appreciate you taking your time with this poll, and on to the next polling question. In 1 or 2 words only, please name the most important challenge relative to transitional housing or permanent supportive housing that Nevada must address. Eight pollers so far. Give it a couple of moments. Once again, thanking everybody for taking our poll. This information is so valuable to us.
Okay, are there any other questions? I'm looking through the chat to make sure I didn't miss anything here.
No, Audrey, this is Jocelyn. There are no other questions in the chat at this time.
Okay, well, thanks so much to all of you. I hope that we are leaving you with some good examples of what we can do here in Nevada. And frankly, that you're inspired. I'm hoping that you see permanent supportive housing and housing in community, perhaps in a different way, because there's lots of different models that serve lots of different people. And I want to leave you with hope, because as many challenges that we see, and cash is always one of them, right? Paying for these beautiful services, but and buildings and operating costs and all those things that go along with it. Sometimes that's the least of our worries. When we have people living on the streets and we have people living in places that are frankly not habitable for humans, there's lots that we can do to wrap our arms around and support these folks. And I hope that we all leave today thinking of ways that we can get involved. So thank you all very much. Thank you to our panelists. I really appreciate each and every one of you. And those of you I haven't visited, I can't wait to see your communities. So thanks so much. Bye-bye.
Thank you.